Good morning, good afternoon, everyone, and welcome to our ECHO session today that is made possible by funding from the Gates Foundation. My name is Lucy. I'm a TB Diagnostics Coordinator at ASLM. Before we start, I would just like to remind you of a few housekeeping items. The session is being recorded and will be for 1 hour. We'll start with a presentation, and then that will be followed by a Q&A section. During the discussion, you can join in through the chat, and you can also add your questions in the Q&A box. We have language interpretation available in French and Portuguese, and you can access this by clicking on the globe icon on your Zoom toolbar, and you can select the channel you want to be on. The session slides and the recording will be shared with you as soon as they are available. You'll also receive an email after the presentation with a link for you to download a certificate of attendance should you wish to. So again, a very welcome to this first session, and it is a first in a 5-part webinar series that is going to focus on TB genomics. During this series, we will explore how countries have been scaling up or implementing the use of genomic sequencing, specifically targeted next-generation sequencing, to improve the detection and management of drug-resistant TB. Since 2014, genomic sequencing has played an increasingly important role in infectious disease surveillance, with perhaps the first applications in global influenza surveillance. But I think for most of us, it was really during the COVID-19 pandemic where we really started to appreciate the full power of this tool. And we could see how it was important to enable tracking of emerging variants and informing timely public health responses. We've also seen how that capacity that was built or strengthened during the COVID-19 pandemic enabled countries to rapidly respond to other outbreaks, such as Ebola and Mpox in Africa. With the recent WHO recommendations on the use of targeted next-generation sequencing as follow-up tests for the detection of TB drug resistance, we now have that opportunity to build on that momentum for TB. Therefore, during this series, we'll hear from experts and country programs that have integrated targeted next-generation sequencing in their national TB responses. And together, we'll explore the frameworks for genomic surveillance, strategies, and practical approaches to implementation of TNGS. So to start us off, we are really excited and honored to have Dr. Francis Chikuse from the Africa CDC with us today. He will provide an overview of the continental policies and frameworks that are guiding the development of national pathogen genomic strategies and how countries can begin to align their efforts with a broader multi-disease sequencing approach. Dr. Francis Farai Chikuse is a Senior Technical Officer for Public Health Policy at Africa CDC headquarters in Addis Ababa, Ethiopia. He leads and coordinates the Africa CDC Institute of Pathogen Genomics policy-related activities to create enabling mechanisms for pathogen genomics activities and subsequent use for public health decision-making. These partnerships aim to enhance the scientific, technological, and effective implementation of the vision and mission of the Africa CDC Institute of Pathogen Genomics and the Africa Pathogen Genomics Initiative. He also leads and coordinates the development of genomic strategy documents in 16 Africa Union member states, as well as malaria molecular surveillance in public health institutions in 10 countries. Dr. Chikuse has over 23 years of experience in public health. He previously worked as a public health specialist in Namibia for the US CDC and as the regional coordinator and senior consultant in public health for the WHO Namibia country office. So thank you again, Dr. Chikuse, for being with us, and over to you.
Thank you very much, Dr. Lucy. Good morning, good afternoon, good evening, colleagues. So, I'm going to share with you in my presentation in terms of the capacity which we have managed to build in Africa for genomics, pathogen genomics, and also we are also looking into human genomics and precision medicine. So my name is Francis Chikuse. I'm a Senior Technical Officer, Public Health Policy at Africa CDC in Addis Ababa. So I'll give an overview at genomics at Africa CDC. So as we are aware that Africa CDC is a public health agency of Africa Union, and it was officially launched in 2017 as a result of the decision by the AU member states presidents. And then there was between 2017 and 2019, and then there was a continental assessment which was done to assess the capacity and capabilities of genomics within the continent. And then in 2019, Africa CDC Institute of Pathogen Genomics was launched. So this was even launched before COVID came in. And the Africa PGI Pathogen Genomics initiative was launched in 2020. And then mainly it was now to respond to COVID-19. And then post-COVID-19, we also have what we call Africa PGI 2.0, which was launched in Lusaka in 2023. And last year, the Institute of Genomics is under formation. And within this institute, we expect to have a unit for pathogen genomics, bioinformatics, and data, as well as the human genomics and precision medicine. So, our role at Africa, the role of Africa PGI is to create enabling and sustainable mechanisms for integration of genomics, mainly in the public health system, since this is the mandate of Africa CDC, as well as to strengthen and democratize sequencing and bioinformatics within the member states, as well as building functional continental-wide network of laboratory bioinformatics, data system, and human resource capacity. Then our role is to establish a continent-wide sample reference data sharing strategy system and governance to promote trusted, quality assured, and timely data sharing, and also to support the design and implementation of high-impact public health priority genomics use cases, and to facilitate the utility of genomic data generated by member states for policy and decision making. So since 2020, we have been building foundational capacity and workforce in terms of we have shared with supported member states with various machines. For example, 11 NextSec machines, 14 MySec, and then 10 MinSec and ISEC, also grid ions, min ions, and also other ancillary equipment, as well as high saver and high performance computers. So our approach is in line with the plan A2 for strengthening bioinformatics and research infrastructure, and the optimized expansion is urgently needed. And also, we are also focusing on how can we sustain genomics within the member states. So in terms of workforce development, we have trained more than 1,000 workforce in 53 member states, and we are also aware of the gender balance. And we also have published a paper based on the work which we have done also on boosting pathogen genomics and bioinformatics workforce in Africa. So in 2018 and 2019, based on the assessment which was done, only 7 countries had functional NGS capacity in public health laboratories, and 48 countries didn't have this capacity. But as of the 2023, thanks to Africa BGI, we now have 9 centers of excellence and 30 countries with functional NGS capacity in public health laboratories. And we are still expanding and establishing capacity in those countries which doesn't have, so that we hope that by 2025, no country will be left unattended. Genomics will be established in the 55 member states. So, although this capacity was built to respond to COVID, then we are leveraging on this, the capacity which we have built, the networks which we have built, to also respond to the outbreaks which are experiencing. For example, we have used the capacity which we have built in DRC and Uganda to respond to Ebola, as well as Marburg in Tanzania and Rwanda. And recently, the capacity which we have built in the member states has also enabled us to have the Clade 1B discovery, as well as cholera response in multiple countries and other outbreaks. And I also want to mention that it was also through the BGI network that we also had the discovery of the Omicron. So this capacity which we have built, we are still strengthening. So the Africa BioNet network can also be leveraged and strengthened and expanded in terms of expansion of storage, data management, workforce development, the modernization, then visibility of stored isolates, and then the governance itself, ethics, and also financing. So we have also identified some barriers in terms of data collection and sharing within the continent, and we hope to unlock these barriers in terms of workforce development, data infrastructure, data quality. The connectivity also in most of the country is still a big challenge, and also cloud solution, and also developing some data standards and also data governance and sharing. So we hope to have a pan-African pathogen genomics data sharing platform to support disease outbreaks. And we are still developing, we now have a data sharing and repository, which is called Agari, based at Africa CDC. So then what's now the way forward? We need to beat the clock. We must leapfrog to genomics medicine, and the time is now. And we are learning from others and make it fit for purpose and time. We are learning from the European Genomic Data Infrastructure and also even the Biobank for UK, as well as the US CDC Data Modernization Initiative. So, as also part of the way forward, we are also leveraging enabling mechanisms and also developing evidence-based strategies and policies at national, regional, and global levels. And we're also building network within our member states and also regional networks and continental networks, and also identifying national and regional priorities for genomics within the continent, and also boosting partnership. So we have also identified that AI can also unlock some of these barriers in terms of ethical, social, but this has got some ethical, social, and economic implementation. Then another challenge, which you have also realized, is in the area of supply chain. So there is need now to procure and even manufacture locally. Remember, we can utilize genomic data to develop new diagnostics, new vaccines, and new therapeutics. And most of these, we are urging member states and also to have local manufacturing of these reagents and supplies. So we are saying no to reagent and supplies in a suitcase. So another challenge which we have identified, which is also in most member states, is the issue of customs. We support countries with reagents, but sometimes because of the custom issues, then these reagents, they can stay at the airports or ports of entry for more than 3 months. In times, they usually even expire. So we must do better. We have to coordinate, collaborate, and also communicate. And genomics is revolutionary, but capacity needs to be expanded across the world and within our continent. So we also must invest in African genomics to strengthen workforce and infrastructural capacity and unlock barriers, and also build on the momentum, trusted partnerships, and leverage to transition from projects to programs. And I think this is very, 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 very critical, because most of the genomics work in the continent is project-based. So there's need now to transform from these projects to programs which are more sustainable. So we must invest, and invest, because the return of investment in African genomics is very, very, very rewarding. So another area which we are focusing is also to support AU member states in developing costed national genomic strategies. And in this, we are moving towards integrating multi-pathogen genomics, leveraging on the existing infrastructure, the capacity network which we have had within the continent post-COVID, and then to support even targeted NGS for TB. And we are also supporting member states to identify their priority pathogens and also use cases. And on this one, we have also, Africa CDC also established 4 expert group. We have got a malaria expert group, and this is also chaired, and it consists of experts from within the continent, and the malaria expert group is chaired by Prof. Jimde. We also have the AMR expert group, which is chaired by Prof. Iruka Okeke, and the vaccine preventable disease expert group, which is chaired by Prof. Nyaga, as well as the foodborne disease expert group, which is chaired by Dr. Ebenezer. So this expert group, they've managed to develop roadmaps for the implementation of priority pathogens and use cases. They've also identified priority use cases. For example, the AMR group, they've identified 3 use cases which can be implemented within the continent, like the pathogen causing neonatal sepsis and hospital-acquired infection, mainly your Klebsiella E. coli and Acinetobacter baumannii, as well as Salmonella enteritica serovar, and the One Health Tricycle framework, including human and environmental sectors, as well as monitoring HIV and TB drug resistance. And then the malaria expert group, they have also identified 5 use cases which can be implemented within the network, and also which we have managed to build. These use cases include monitoring drug diagnostics and insecticide resistance, and also elucidating on the transmission dynamics. And these are the 4 expert groups. They have finished developing the roadmaps, and they're now under our science office for validation, and we hope that in the next coming week, they'll be available to the public, and also then this can also assist member states in implementing their priority pathogens and use cases. So as Africa CDC, we view genomics in terms of end-to-end framework, starting with use case design, the sampling part, as well as the laboratory processes and genetic data generation, the data processing and the analytics, and also the data integration and the repositories. And from this data, then it will be able to inform public health decision making. And this end-to-end framework is applicable to multi-pathogen. In terms of developing national genomic strategy documents, we have targeted the initial phase, we have 16 countries, which are stated here. And some of them, they've already launched, and some of them, they are already finalized, waiting for launching. So we first had a regional workshop in country, multi-stakeholder workshop for finalization and validation, and then the next stage of the launching, as well as the implementation part. So we also have some resource documents, like the Africa CDC Pathogen Genomic Surveillance Policy Framework, which was validated by more than 40 AU member states. So this is an African document, and the member states, they're also utilizing to develop their national strategy, as well as the Global Genomic Surveillance Strategy by WHO. So for the Africa CDC Genomic Surveillance Policy Framework, it has got 7 priority areas in terms of capacity expansion, workforce development and retention, coordination, governance and leadership, as well as quality management system, supply chain and access, as well as financing and sustainability. And for financing, we are encouraging member states to have domestic financing. So we have started this even last year, encouraging member states to have them domestic financing. And I think we can also agree with me that with the changes within the external funding globally, then there's need now to make sure to focus that we have domestic financing. So at Africa CDC, we are not being reactive. We have been very, very, very proactive in make sure that we have domestic financing in our genomics, as well as the 7th priority area is also in data governance, the analytics part, and also who have all the access, and then the sharing component, as well as the storage and technology. And then the global strategy has got 5 objectives, but only the difference now is Africa CDC genomic surveillance policy framework. You have, in addition to these 5 objectives, it has got also issues of supply chain, which is which has identified by member states and which we are also addressing. So in terms of the guiding principles for the Africa CDC genomic surveillance policy framework, it has got guiding principles. And it is our role to make sure that countries take the center stage and have national ownership. And also it is public health focused, and we encourage multidisciplinary partnerships, and also equitability, and also sustainability in terms of even domestic funding, as well as data governance and the One Health approach and emergent preparedness. So we have countries which have already launched their documents, like Ghana, Ethiopia, as well as Zambia, and 8 countries, they have already completed their national strategy documents, and also they are preparing to launch between now and June 30. And we are also, in addition to development of supporting the development of national strategy genomics, we are also encouraging member states to establish national genomic consortia. And this involves multi-stakeholders, like the role of the academia in the development of these national strategy, and also implementation of priority use cases, the research, the private and public health laboratories, including ministries of One Health. So mostly when the countries, they launch their national strategy, they also sign the MOU, so that this consortium will be very, very, very crucial in coordination of genomics within the member states. And also some countries, they're also integrating human and forensic genomics into their strategies. And we've had the first regional meeting, which was attended by 16 countries in Zambia, Lusaka last year, as well as in-country workshop to finalize and validate these national strategies. We've been to Uganda, we have been to Zambia, we have been to Malawi, we have been to Republic of Congo, Brazzaville, we have been in Togo, to Rwanda, as well as Mozambique. And currently this week, I'm in Namibia, and we've also finalized their national strategy document. But what have we learned in terms of developing this national strategy document is that we also collaborate with in-country partners like Global Fund, WHO, USCDC, CHI, in developing of these comprehensive national strategies. But our role is to support the development, but the ownership, it has to be, it is at country level. So we have also learned that seamless integration of genomics into existing public health programs or frameworks help to streamline implementation and maximize impact. And then prioritizing early engagement of all relevant stakeholders rather than seeking buy-in on a completed document is crucial for ensuring that these strategies' relevance, feasibility, as also ultimate success. And also, comprehensive partnership between public and private laboratory, academia, research institutes, and other sectors will ensure sustainability of genomics in member states. And also, they can, as a consortium, they can also apply for grants. And then the coordinated action among stakeholders to improve across sector learning and address supply chain related challenges. It needs also in-country partners as well as Africa CDC. And one of the major challenges, which also these national strategies also addressing the issues around supply chain. So you'll find that amongst those 7 priority areas, the countries, they also have now a costed implementation plan, and one of which is to address supply chain challenges. So in Africa, among the matters that complicate the supply chain space, particularly for pathogen genomic sequencing, include poor logistic infrastructure, which limits the smooth and efficient flow of cold chain cargo intra and extra-continentally, in heterogeneous and stiff regulatory environment, specifically with regards to custom processes and cross-border regulation. And one of the things which was also encouraged during the in-country workshop to finalize document is also to include even representatives from the ministries involved with customs, so that they also are aware about the role of genomics and also how the issue of customs, they can also impede the genomics in member states. And then lack of channel partner capacity to support sales, installation, training, maintenance, support of genomic sequencing and supplies. And we have been advocating as Africa CDC on equipment, reagents, and consumable IT systems, maintenance, support, and bioinformatics and data management. And also to, in terms of regulation, we have encouraging engagement between various ministries and supply chain meta experts to ensure more streamlined regulatory mechanisms, and also the engagement with non-governmental organizations, as well as the commitment from the private sector in terms of installation, training, service agreement, and supplies via distributor network. And another challenge which also we have experienced within the continent is the bioinformatics. This is a real and big challenge, because most of the bioinformaticians, after graduating, trained, and then they will go for greener pasture. So we need also to come up with also mechanisms of our workforce in addition to development, but also workforce retention. And bioinformatics is one of the our main interests. So currently we have a short-term bioinformatics fellowship, which we intend to have 100 fellowships among the Africa Union member states, and the deadline for the application of this is 20 April. So we urge those, especially public health practitioners, as well as those who have got a bachelor advanced degree in relevant field, to e.g. molecular biology, medical bioscience, and also those who have got demonstrated interest and experience in bioinformatics and public health to apply for this fellowship. And with this, I would like to thank you, and I'll be ready for questions. This is the Africa CDC reference laboratory in Addis Ababa, Ethiopia, and I would like to acknowledge these partners. Thank you, and over to you, Dr. Lucy.
Thank you so much, Dr. Chikuse. This was really a brilliant presentation, and I think it has helped us all to start thinking about the capacity that has been built over the past couple of years by the Africa CDC, and we're really grateful to the Africa CDC for the work that you have been doing in that regard. And I think one thing that I really caught on when you were presenting was the fact that we need to learn from others, we need to collaborate and to design genomic plans that are fit for purpose. And I think one thing you highlighted brilliantly was the need to develop these cluster genomic strategic plans that bring in all partners, so including academia and even including the animal health sector, to ensure that the strategy articulates a shared vision across the broad range of disease programs to ensure that we are not duplicating efforts or creating silos. So I really thank you for that enlightening presentation. I think it's a nice segue to a question that came in from Elaine Nyaruhirira, and she said, good afternoon, based on the use cases that you presented and proposed, do you mean to say that all capacitated countries, all capacitated member states will be able to test or analyze these pathogens, or you design a network with dedicated and specialized labs for each disease?
Thank you very much. Can I take another question?
Or you want me to give you two?
Yes.
There is one that came in from Taiwa, and they say, what's the role of genomics in blood transfusion? Do you want me to include another one, or you want to take those two for now? Dr. Chikuse?
Yes.
Do you want me to read another one, or you take those two and I give you additional questions?
Yeah, I think I can take this. Yeah, this one. So thank you very much for asking that question. So member states, there are different levels in terms of the capacity, as well as also the workforce who are able to do genomics. So what you do first, but our role is first of all build capacity within the member states. But within our network, if the member states, they don't have that capacity, we also have what we call specialized centers, which will be able to assist countries in terms of those priority use cases and pathogens which they cannot do sequencing. But what I would like to say is, I mentioned about the expert group which were developed. They were able to come up with use cases which can be implemented by all the member states. So the capacity, yes, is there, but in some states, in some countries, it's not yet developed. But if it's not yet very advanced, then we encourage them to utilize our centers of excellence. We have got a very robust sample referral system within the Africa CDC network. We also utilize our network information management system called NIMS to coordinate the sample referral, as well as also the distribution of reagents. So our role is to make sure that, you see, we must build capacity in all the member states, but they are still at different also stages. But we still have centers of excellence, and all the sequencing can be done within the countries. For example, we also have some projects which are piloting in the within the member states, like the cholera genomics, which is called the CoGen, which is among 7 countries. And then for the first time, we are able to sequence cholera within the continent. And for the first time, we're able to do regional analysis. But the capacity we built it for CoGen, but our approach is whatever capacity we built in member states is not specific for cholera. Cholera is a bacteria. So what we are saying is member states, if, for example, HIV drug resistant, which is also TB drug resistant, TB, which is a bacteria, they can be able to utilize the capacity which we have used, developed to also address their national challenges. Then coming on to the role of genomics in blood transfusion. So currently our focus is in pathogen genomics, but we are still trying to develop human genomics and also precision science, and we are still engaging the member states to identify also their priority and also addressing, I think, with human genetics and precision medicine, the main focus is the ethics part. So we are still engaging to member states to identify those priorities, and then maybe that will be the time also when you also realize what will be the role of genomics in blood transfusion science, and also how do you address the ethics component. Thank you, and over.
Brilliant. Thank you so much, Dr. Chikuse, for those responses. We have a question that came in from an anonymous attendee, and they said that thank you very much for updating on this information, but it is very necessary technology on high burden area like Africa, e.g. a country such as Ethiopia with a high burden of TB, HIV, malaria, and other bacterial infections. How can Africa CDC expand genomic service at lower levels of the health facility to investigate practical, I guess it's to say to control drug resistance at a practical level? Did you catch the question?
Can you repeat again?
So it's saying that how can Africa CDC expand the genomic services at lower levels of the health facility to control drug resistance?
Okay, thank you very much. So this one is also country context and also how genomics is structured. So for some countries, like Ethiopia, for example, they've got what we call core sequence facility, which is a more centralized approach. But in some other countries, they prefer to have a decentralized system within various province and district. So it will depend now on the model which the country is adopted, and also how they want Africa CDC to support that that model. It's not the prerogative of Africa CDC. We listen to what the member states want from us, and then from there, we implement. So depending on their model which they are using, the centralized one or the decentralized one, we always give support so that even the lower levels, they are also represented. So then genomics becomes nationally. Thank you, and over.
Thank you. And I think this almost follows in that same line from Innocent. And they say, why is the capacity building for genomics and bioinformatics focusing only on public health labs?
Okay, thank you very much. So I think we need now to go back to what is the mandate of Africa CDC. Africa CDC is a public health agency of Africa Union. So our focus mainly is within the National Public Health Institutes and national reference laboratories. So this is our focus. But however, we have realized that these institutes which are supporting, they cannot work alone. This is why we're encouraging partnerships to say academics, they also have a role to play. For example, in workforce development, they have a real role to play. So this is why we are encouraging the development of these consortium to include academia, where we still have a lot of, skills transfer to also assist national reference laboratories and also national public health institutes. Thank you, and over.
Thank you. The next question is from Aka, and they say, could you speak more about the bioinformatics training? I guess they really want to know how they can, what's the application process? I guess if you could just explain a bit more about that training you mentioned in your last slide. Thank you.
Okay, about this one, I think everything, the requirements, they are on our website. You can just go onto our website and look for that bioinformatics fellowships. All the information is there. But what I just want to mention is that the closing deadline is approaching 20 April. After that, we'll be taking no applications. So the sooner the better. All the information, all the requirements is on our website. Thank you, and over.
Yeah, and thank you for mentioning that deadline. So I hope people can get their applications in. The next question is from WOPA, and they asked, is there support for, is there financing to support medical laboratories in terms of quality? So with this genomic capacity, yeah.
Thank you very much. So I think when I was making the presentation, I mentioned that one of the priority areas in the Africa CDC genomic surveillance policy framework is on quality management system. And something which we are also assisting member states. So as they develop also that their national strategy is also another area which they also have identified that is also critical for them. Because our role is to make sure that we produce quality data in real time. So yes, the quality management system is an area which we are also supporting member states very well. And in their costed plan, they have various activities which are also geared at supporting a quality management system. Thank you, and over.
Great, thanks, Doc. So one person noticed from your slide where you showed the 16 countries that were selected, they noticed that their country was missing from that list of countries. So they asked how were these 16 countries included, and is there a plan to increase the number of countries that will receive the support for the costed genomic plans?
Yeah, thank you very much. So firstly, one criteria which was used is because there were countries also who has already started developing their national strategy, and then we chipped in to make sure that they finalize their document. Then also there were countries who had written to us requesting support for those who have not yet developed, requesting support for these. And then we also assisted and responded to them. So basically, if a country wants to be supported, they can just reach out to us. But currently, we are still facing some financial, the finance to support this is still critical, but we are also looking at means and ways to see how can we also expand it. But our focus for this year is only 16 countries, but they can still reach out to us and then. But if you look at those 16 countries, they are also representative. We try them to represent the 5 regions of Africa CDC. We have Morocco from North Africa. We also have countries from the western side. We also have countries from the eastern side. Then we also have countries from the central side, as well as the Southern African region. Thank you, and over.
Thank you. So with an early question from Wesonka, and he was really following on the vein that you talked about Africa CDC focusing on precision medicine. And he asked if Africa can really develop its own locally tailored vaccines. And I'll also ask this question in the next session when we have the TB experts. But from your discussions at a regional level, what is the opinion of Africa CDC on capacity for Africa to develop its own vaccines based on genomic insights? And he also or they also asked a follow-up questions regarding the data sovereignty and how we can maintain data sovereignty when we are sharing data with global genomic databases. Over.
Okay, thank you very much. So I think one of the lessons which we learned from COVID-19 in terms of vaccines was that we didn't receive enough vaccines the way we wanted. And Africa CDC took note of that. So one of its focus is part of new public health order at Africa CDC is to promote local manufacturing of diagnostics, of vaccines, and therapeutics. And we are going also to utilize the genomic data which we generate within the continent. So some countries have started off. They are also, you see, piloting the production of vaccines locally. And this is very, 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 very encouraging. So this is also another area which we are now saying, let's produce our own vaccines locally. Let's produce our own therapeutics and also our diagnostics. And I think it has gained traction. Many countries, they have already started doing that, and we are really, really, really supportive of that. But again, there are always teething problems, which we're also expecting in terms of also financing. So it's also another area is to say they can also have smart partnerships with global players, but the manufacturing being done within the continent. So this is also another area which we also are supporting. Then on the issue of data, yes, I think this is very, 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 very critical. There are two things with genomics. If you don't know the reason why you're doing genomics, please don't do it at all. You must be answering a question, or you must have an objection. Why am I doing genomics? Okay. So then the next thing is we have to produce data in real time, and then that data has to be shared. So if you don't share your genomic data, then we haven't done anything. So, but the issue of data is very, 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 very sensitive. As you know, that data sharing is just based on trust. So what we are now encouraging member states as they develop their national strategy is they need now to come up with data sharing agreements where they can determine that, okay, if we produce this genomic data, we can share up to this level. This is what we can share. So if you look at among the implementation plan, some of their activities are going to be centered on workshops to develop these data standards in alignment also with other laws and also regulation within the member states. And this also not only including the access part of it. Who has got access to that genomic data within the country? And also the countries must have ownership and to decide whom they want to share their data, as well as another critical component in terms of data is the storage part of it, which is also a very, very, very component. So all these, the analytics, the access, the sharing, and the storage forms the basis of data governance. And I think most member states, they are now beginning to realize that they really need to have ownership and they really need to decide whom they share their data. And for them to do that, they need to have data standards. They need to have material transfer agreements. Thank you.
Thank you, Dr. Chikuse. We just have time for one more question, and there's a question that came in from Tatenda, and they say that, are there any Africa CDC genomics initiatives on non-infectious diseases, including cancers and NTDs?
Yes, there are. This is why, like I've said, when we started, it was the genomics was mainly for pathogen specific. And then, but now we are also moving into precision medicine. And I think cancer is going to be one of the non-communicable diseases which we are going to have focus on. So yes, we are, it is still in funds. We started last year, but we are moving towards that direction as well. So we looked at the priorities for the continents. For most of the priorities, they were infectious diseases, but now we are also moving into non-communicable disease. Like I've said, we're also doing a lot of assessment to also identify what can we include under human genomics, and also which other non-communicable diseases also can genomics also play a role. So yes, we are focused in moving towards that. And thank you.
Thank you so much, Dr. Chikuse. I think this discussion really helps us to see the capacity that is available at the continental level. And I think it lays a really great foundation for the next sessions in this series, where we'll really now start focusing on TB genomics and really see what countries have been able to do to implement targeted next generation sequencing in their programs. And you hear an example from Eswatini, for example, that are even using targeted next generation sequencing for stool, and that will really go a long way in improving detection of drug resistance in children with pediatric TB. So we really have some exciting sessions lined up, but this was a session where we wanted to just get an overview at the continental level of what is the capacity available, and how do countries actually develop their genomic strategy to involve a broad range of priority pathogens across disease programs. So Dr. Chikuse, if you have a final word, closing remarks, and then I'll give the next steps. Thank you.
Thank you very much also for giving me the opportunity to share our work at Africa CDC. So my parting shot is that let's work together. We'll continue to, as Africa CDC, will continue to support member states. And the time to revolutionize genomics is now. If you lose this opportunity, we will not have other opportunity. And also in terms of targeted NGS for TB, I've been in touch with various actors, for example, from the I'm in Namibia, and also the focus was there for them to maybe to have a network within the region, the Southern African region. They can link with Botswana. They are doing a lot of great work. South Africa, they are more advanced. So they can take into those skills, and then also they can develop their capacity nationally. So it's the time to revolutionize genomics, and let's have respectful partnerships. Let's work with others and learn from also others. With that, I thank you.
Thank you so much. And we have a lot more questions coming in. Unfortunately, we have to wrap up, but we will provide Dr. Chikuse with all the questions you've sent in, and he'll provide his responses, and we'll send this along with the link to the slides, and they'll be on our resource page. And as I mentioned, you'll receive an email with a link to all these resources, as well as where you can download your certificate should you need to. And as I've mentioned, that this is the first in a series that we are organizing on TB genomics, and will focus specifically on targeted next generation sequencing. And our second session will be on the 8th of May, so be on the lookout for that invitation. And we look forward to having you join us as we continue to explore practical steps towards advancing TB genomics. Thank you once again and take care. Good afternoon, good evening, everyone. Bye.
Thank you, everyone, and bye-bye.